My name is Ben Domaingue, Managing Editor here with WestfordCAT. We're introducing a new series with our Community Wellness Coordinator, Nicole Laviolette, where we speak with those involved in making your life a little more healthy. This week, we're joined by Alison Christopher, Westford's town social worker. Thank you for joining us, Alison.
Thanks for having me.
So I guess to start things off, I'd love to just hear from you guys, and you guys can tell the audience, tell me a bit about what you guys do. A lot of people may not know what you do, and I know for you, Nicole, your position is relatively new. You were just hired on back in May, if my memory serves me correctly. So I guess we'll start with you, Alison. Can you tell us a bit about what your role is and how you, help residents out?
Sure. So I'm the town social worker and the Council on Aging social worker. So I work out of the Council on Aging at the Senior Center in Westford, the Cameron Senior Center. And my job is basically to assist older adults and any adult over age 18 in the town of Westford with a range of challenges that they might be dealing with. So I might meet with someone about housing issues, financial challenges, needing to get connected with different benefit programs to help with food accessibility or heating assistance. I meet with people who are struggling with health or mental health issues and might need to be connected with providers or to have assistance navigating the healthcare or mental health care world. And then I do a lot of kind of pre-planning with older adults on how they can live their lives as well as possible as they age in place in the community, and how to think about what they might need as their health or other needs increase. And so it's different every day, I guess I would say. Different things and different people every day, but all very interesting and enjoyable from my standpoint.
No, absolutely. And just for clarity, you don't just work with seniors, right? You'll work with anybody, even I'm 22, so someone my age, if I needed help, I could come to you?
Absolutely, yes. I don't work with children because mainly the schools handle the children in town, but yeah, I work with a lot of younger adults, sometimes parents, sometimes single people, sometimes married couples without kids. There's a huge range of people that I connect with, and a lot of my younger clients tend to be people who are residing in some of the affordable housing complexes or some of the affordable apartments in town. They tend to get referred more frequently because people know more about what I do as it relates to financial assistance resources. But once they get to me, I really can help people with other things as well. It just kind of depends what's going on in their lives that's impacting them.
Absolutely. And for you, Nicole, can you tell us a bit about what you do around here?
Sure. So I'm the Community Wellness Coordinator for the Town of Westford. It is a new department/position as of May of 2022. So I'm a support for the community around education, outreach, for information around mental health, substance use disorder, really any supports and resources. So there are some similarities where families can connect with me as far as connections to resources around mental health, substance use disorder, domestic violence, interpartner violence, and connections to those resources and supports in the community. I do get connections from the school guidance counselors, school adjustment counselors, with families that might need a little extra help or guidance in connecting to resources and supports. So I'm also a resource for town departments. So as far as the police or fire departments or school departments, any departments within the town that might have questions to be able to support the residents that they may be working with as well.
Absolutely, absolutely. So I know when we spoke about starting this series, we wanted to delve into a bunch of different topics that might impact residents, be it illness, COVID, anything like that. But I know we kind of talked about, we wanted to talk about maternal mental health a bit, as well as senior wellness, which to some you may look at that and wonder how are they connected, but you know, you have to look at health holistically. It's all connected. So I guess, you know, can you tell me a bit about why, you know, this specific issue when we were talking about maternal mental health, why is that important? Why should someone like myself be concerned about that, and why should someone in the greater community be worried about that?
So I think it's an understanding and education of what's happening in the community, you know. So, you know, maternal mental health is from pregnancy until postpartum, you know, so as far as those thoughts and feelings that a woman may be having during the pregnancy and the weeks following their delivery, you know. So as far as for the community and for residents, you know, you never know who may come into your life or who your neighbor may be, and so having an understanding of all aspects of mental health, you know, so around maternal mental health being one of them, as far as an understanding, you never know who you may be able to support. So having the knowledge about what it is and how you can maybe support a friend or a relative is always helpful.
Absolutely. Can you go a bit further on how, you know, someone might be able to support someone who is pregnant or, you know, postpartum and just had their kid? I mean, I'm sure for anybody who's had a child, it's probably one of the happiest days of their lives, but you're still, you know, all that stress and all that worry, it still impacts you.
Yeah, so I think sometimes it's it may not be the woman herself that recognizes it. It may be, you know, friends or relatives that may see, you know, these pieces. So, you know, as far as prenatally and postpartum, recognizing that you're exhausted, you can be overwhelmed, there can be sadness, and then really recognizing that, you know, if it's happening and occurring for a greater length of time, then maybe that's the time to seek help. You know, so as far as, you know, knowing that it is okay, that you're not alone, that having these feelings, you know, is normal, and then talking to somebody, or if you're observing these for the mother, then, you know, it's okay to ask for help for that person.
No, absolutely. And you know, I know you kind of mentioned, you know, people might feel sadness or anything, but are there any sort of telltale signs of concern that someone who, you know, maybe married to someone who's expecting, or someone who is expecting, who's you know, having a child, could look for? Are there any specific ones?
So there's a list. There's a long, and it can be a long exhausted list. You know, so I mean, I think the exhaustion, the sadness, some people call it the baby blues. That's, you know, pretty common in women. It's when it gets to be an extensive and maybe a little bit more intense. You know, so those feelings of, you know, sad or hopeless most of the time, not just occasionally. You know, lack of interest in doing things that you've really enjoyed most of your life, not taking care of yourself as far as, you know, hygiene and things of that such, having negative thoughts, you know, of hurting yourself or hurting somebody else, trouble coping with daily tasks that you've done all your life, feeling very anxious and nervous all the time. So it's also looking at it for more than a thought, you know, that it's lasting a few weeks, and then that's when, you know, you're connecting with your OBGYN or the National Maternal Mental Health Hotline, and not just that person that's experiencing it, but those loved ones can reach out to get help for that person.
So what I'm sort of gathering is, you know, if you're looking for these signs, or you're expecting and you want to know, like, am I doing all right? You know, a thought is okay. That's normal, right? As long as it's not lingering, or, you know, something that is persistent for an extended period of time.
Yeah, I think that, you know, that thought of hurting yourself or harming somebody else, whenever you're having those things, it's always good to talk to somebody, because you never know where those things could go. So reaching out to your OBGYN, or reaching out if you had a midwife, or reaching out to your primary care doctor, or if you are seeing a therapist, reaching out to that person. If you're the loved one of that person, it's okay to reach out to those people too. You know, those periods of having thoughts and feelings of sadness and exhaustion, you just had a baby, you know, there's all these feelings, they can last for a short period of time. It's when it goes over 2 weeks, you know, during the pregnancy or postpartum, when really it's a good idea to get help. And it's okay to just talk to anybody, even if it's only a week, you know, to see kind of what those thoughts and feelings may be occurring within that person.
Absolutely. And if you're sort of looking at health or wellness holistically, you know, it's, I don't know all the aspects, but, you know, there's social, there's emotional, there's physical, you know, it all goes into that. And, you know, you would think having a child, you'd be incredibly excited, but obviously there's things that can happen where you're upset or you're stressed or nervous. I mean, all these things go into your head, which, is normal, but good to talk to someone. And I guess that would, lead me to you, Alison. So I know, you primarily work with seniors, and, seniors have probably already had their kids and already dealt with that, but, wellness is a very holistic theme, I guess, and focusing on, some of the most vulnerable in our population. Can you tell me a bit about sort of what you see with senior wellness and I guess, if you want to take care of someone who's elderly, right, telltale signs of something that's not going right in their life. So you go a little on that?
So, yeah, I mean, it's a little bit different in working with seniors because we have the benefit of having a robust senior center in this town. And I think that allows us to get to know more people and to be a support for seniors in a way that's different than maybe younger adults would have an opportunity within their community to get connected with people. So, with seniors, I think depression or mood issues are definitely not considered a normal part of aging. But when you think about getting older, you realize that the general population has a number of stressors that we all go through that can contribute to the possibility of becoming depressed. As we get older, there are changes that happen to our bodies, to our minds, to our environments, to our social connections, and all of those things are just added to the stresses that the general population might have. So there are definitely additional triggers for depression that older adults might have. And what we really try to do when we're working with seniors is to assess them holistically and to think about what are the elements that go into someone living as healthy a life as possible for as long as they can. So that might be from the mood component, from prevention of depression or treatment of depression, as well as overuse of alcohol and other substances. So hopefully preventing people getting to the point where they're doing that because of boredom or isolation. And then you move to all of the other aspects of a person. So people's physical well-being, maintaining their physical functioning as much as possible. So we have all kinds of yoga and Tai Chi and exercise and Zumba at a fitness room. So targeting those kind of physical components of wellness is really important, I think, for people's overall feeling about themselves and their overall health. Sometimes almost equally important is maintaining and enhancing people's social connections. One of the things that is hard for a lot of people when they get older and retire is not having those connections that they might have had in the workplace, not having children at home where they might have had social networks with their children's friends or within the schools. So finding ways for people to connect with others in their own age group, either maintaining what they've had or doing new things, is something that I think happens really nicely at the senior center. And it allows an opportunity for people to make new friends in a way that doesn't naturally happen, I think, kind of out in society. Other things that don't necessarily seem to directly be related to wellness, but are really important to maintaining one's health in older years, is having appropriate housing and transportation, the ability to get places, having the financial means to afford medications and food and other things that we need. So those are all also areas of focus that we try to provide information and education and support resources on. And then just, I guess, supporting people through whatever they're going through from an emotional standpoint, whether it's losses that they experience as a result of age, losing friends, spouses, bereavement issues, and having an understanding that things change with people as they get older. And we need to support them in different ways and be talking about different things that we might have been less likely to talk about when someone was in their 30s or 40s. So really assessing where people are in their lives in terms of their family and friends and network, and trying to help them bolster that as best they can.
No, absolutely. And I think, when thinking about these two, what seemingly are very different topics, what I feel kind of brings them together is these are two of the most isolating periods of someone's life, either old age or losing loved ones, or, I can imagine. I'm 22. I haven't had kids, but I know people who have, and they lose a lot of people when you have to take care of a child, and that's your whole life now. And so it's, it's a very isolating experience, whether it be good or bad. It's, you still lose a lot. And that certainly has not, it's certainly probably been exacerbated by the COVID-19 pandemic. So I guess, could you go a little bit into that on how, especially for some of these vulnerable populations, seniors who were disproportionately affected by the pandemic? I mean, I'd imagine it's made it a lot worse, but, how has I guess your role in the town work to sort of combat that? And
when the pandemic started, there was a lot of concern for the senior population, just because there are so many people who utilize the senior center and who are participating in this kind of programming and big group meals and big group exercise classes, and we weren't able to do that for a period of time. Interestingly, I think that the seniors, or I would say the majority of seniors that I know in town, have felt that the benefits outweigh the risks of them coming back to the senior center, and we have been back to running a full slate of programming for quite a long time now. So there's been a comfort level with people choosing to wear masks, doing things to protect themselves if they are at higher risk. But people have really found ways, and we have found ways to provide programming both when the pandemic was more isolating and now, that people have come back and have really found a lot of support in that setting. When it was less possible to be together in person, our program coordinator and director did a lot of work to do remote programming, to do drive-through kind of stuff. The outreach worker and I did a lot of calls to people at their homes, visiting people in their garages or outside, meeting with people outside at the senior center if they weren't comfortable coming in. And I think all of those things together hopefully have felt to the senior population like it's been an ongoing support for them during that time. We had a time where the Merrimack Valley Reserve Corps had been doing food shopping for a huge number of seniors at the height of the pandemic, and we were taking grocery lists from people every week that didn't feel safe going out to the stores, and the volunteers were shopping for them and dropping it off at their house, and that is something that I don't think that people have forgotten, how wonderfully the volunteers came together and supported them.
Mm-hmm. Absolutely. And I know, there's been a lot of support even from the town. For seniors who may be watching, I know the town has recently approved through ARPA rental assistance programs that you can apply for. It's based on your income, but I know that's available. I believe $30,000 was approved at the last batch. I don't know how much is left, but
Yeah.
I know that is a resource available
Yeah.
to people who may be economically struggling. So I look at both of these topics, and I think, again, to myself as a 22-year-old man, these are two of the most vulnerable populations in our community, be it however big or small. How can we help? How can people outside of these demographics help? What can we do?
Do you want to start, or do you want me to?
So I think a piece with community is understanding, so I think that piece with mental health overall is destigmatizing, the conversations around mental health, normalizing conversations that, just like you go for a physical every year, maybe you go for a mental health check every year, that piece of normalizing this conversation, so that, women may be going through these moments and having an understanding of what it is as a community. And having those conversations as a community, even if it isn't directly affecting you, like I said, it may be affecting your community and your neighborhood. So, and understanding and conversing about it.
Absolutely, absolutely. Do you have anything to add?
Yeah, I mean, I would say one of the things about living is that if you're lucky enough, everyone gets older and everyone becomes an older adult at some point, if they're still living. So I feel like it's important for people to have an understanding before they get there of how you want to plan for your older adulthood. But the other piece of that is when you're not an older adult, you are almost always having relatives or people around you who might be. And you want your parents, if you're an adult, to be doing well. You want your kids' grandparents to be doing well. You want your neighbor, who might be an older adult, to be doing as well as they can do. And I think just by knowing that there are supports available to a population, those people around you can say, I notice you seem to be down lately. You seem to be staying home more and are all by yourself since your husband passed away. Do you know that the senior center is there and that they have a social service staff that could talk with you? A lot of our referrals really come from word of mouth, from neighbors, and not always older neighbors, neighbors that just know about the senior center and are concerned about someone that lives here, or someone who sees an older adult in the post office and notices that they seem a little off and maybe their memory has been failing lately, and they, know enough to reach out to us and say, can you check on this person? Can you see if they want any assistance? So much of it, I think, is just the importance, as you said, of education, so that the general community knows what's available to them and to others, and can, in a supportive and caring way, say, hey, have you thought about accessing this? It might be helpful for you. Do you want me to help you contact this person? I have a friend that talked to this person and she was really helpful, and maybe she could do the same for you. So that's why I like to get the word out to people who aren't seniors in Westford, and make sure that everyone knows what we have to offer.
Mm-hmm. No, absolutely. It seems like what I'm getting is an informed community is a healthy community. Is
well put.
Sort of the vibe I'm getting from what you're saying.
Yes.
But no, that's wonderful. Are there, kind of a loaded question, but are there things that people shouldn't do? Are there any things that might actively harm someone, even if you're trying to help, that people shouldn't, like common things? Are there any things you can think of?
Yeah, I think sometimes we always have the best intentions, I think, when we're speaking with anyone, our neighbor or loved one. And so sometimes sidestepping or putting aside those person's thoughts or feelings, speaking around that person's mental health, as far as, especially when you've just had a baby, everybody has a thought, a feeling, an opinion that they'd like to share with that person that just had a child. And sometimes it comes across as, oh, don't you worry, it'll go away. Those thoughts will, oh, don't worry, just But sometimes there is that worry and concern, you know, so to say that to somebody that's having those thoughts and feelings might actually isolate them even more, because then they won't want to share those thoughts and feelings with anybody else. So sometimes, you know, you may thinking that you're trying to help that person in that way, but really it's opening the conversation instead, you know, to talk about the thoughts and feelings, and then in turn being able to say, well, there is this National Maternal Mental Health Hotline, or there are people in town that you can talk to that will be able to help you to get support.
Yeah, sometimes if you're not already skilled or comfortable with a topic and you want to help someone, things can go a little bit south in the way that Nicole is describing, where someone may not know what to say and may kind of say something that is less supportive than they mean for it to be. And active listening is oftentimes the most helpful thing that someone can do if they're not a professional, and just really listen for what that person is saying and then let them know that there is help available. You might not be the person to say all of the right things to them, but being able to say, you know, I've heard that there are other people struggling with what you're saying, and maybe you should call this place and they could give you some ideas of what to do. I feel like that's often better than sometimes the suggestions that my clients get, and they say, oh, you know, I know that person meant well, but when they said that, you know, my spouse is at peace now, and you know, it's good that he didn't suffer any longer, or whatever the case may be. You know, there are things that are not taken as well as people mean them sometimes. So yeah.
No, absolutely. So I guess just to finish off, is there anything else you guys want to share that you feel is pertinent that people should know about?
I always think that just sharing that, you know, that they aren't alone. You know, so that there are people in the community, there are town employees that can help support. You know, we have, you know, various departments, you know, that they can call and ask for help. So just to know that they aren't alone for themselves, their family, or their neighbors.
Absolutely. Do you have anything else to add? No, you're
That's
good?
very well put.
Very
I don't
well
know if I can top that, so I agree, yes.
Perfect. And, you know, I know there's, you know, you guys have your numbers and emails on the website. People can reach out to you. There's the National Maternal Hotline, which I don't know off the top of my head, but that will be in the video description. We'll put that in there, and we'll be sure to put, you know, all of the resources that both Nicole and Alison offer. But for both of you coming on today, I just want to say thank you very much.
Thank you.
Thank you.